Liver is turning black. How can you tell? In this video, we're diving into some signs that could show your liver is turning a dark, blackish color, meaning it's very unhealthy. Knowing these signs is very important because it means you can start doing things to help your liver heal before it gets worse. And guess what? Your liver is kind of a superhero. It can fix itself with a little help from you. Stick with us till the end of this video because we'll also share some easy home remedies to help clean out your liver and detoxify it to stop the damage from getting worse. A lot of people think liver problems are just from drinking too much alcohol. But that's not the whole story. Eating too much sugar, junk food, fast food, and using certain painkillers like acetaminophen, that's Tylenol, or ibuprofen can also make your liver unhappy. And there are other things too, like certain viruses that cause hepatitis that can hurt your liver. Understanding liver health. A healthy liver is reddish-brown, and you can't see or feel it because it's tucked away in the upper right side of your belly, under the diaphragm. If the liver's color or size changes, or the way that it feels when you touch the area where it's located, it might mean there's a health problem. Causes of liver discoloration. Certain conditions can lead to liver discoloration or the appearance of darker blackish spots. The first condition is necrosis, which means that cells in an organ or tissue die because of sickness, injury, or not getting enough blood. In the liver, this can happen for many reasons and can cause serious health problems. When liver cells die, the liver can't do its job well, like helping with digestion, cleaning toxins from the body, and other important tasks. Liver necrosis, or liver cell death, can happen for many reasons. One reason is infections. Hepatitis viruses, types A, B, C, D, and E, and other infections from parasites or bacteria can kill a lot of liver cells. Another reason is toxins. Drinking too much alcohol, using drugs, prescribed or illegal, or being around harmful environmental chemicals can damage and kill liver cells. Taking too much acetaminophen, Tylenol, is a common way this happens. A third reason is ischemia. If the liver doesn't get enough blood because of blocked vessels or shock, it can lead to cell death due to not getting enough oxygen and nutrients. Also, autoimmune diseases can cause necrosis. Sometimes the body's immune system wrongly attacks liver cells, causing damage. And lastly, metabolic diseases can cause necrosis. Certain conditions that affect how the body processes minerals, like too much copper, Wilson's disease, or iron, hemochromatosis, can also harm the liver. When liver cells die, they release their insides into the blood, which doctors can spot using liver function tests. These tests check for enzymes levels like alanine transaminase, ALT, and aspartate transaminase, AST. Their levels are higher when there's liver damage. Under a microscope or in imaging tests, the parts of the liver that have died might look darker because of all the dead cells and inflammation. But you can't see these changes without special medical tools like scans or during a liver biopsy. Symptoms of liver cell death can be yellow skin, jaundice, stomach pain, swelling, tiredness, and other liver problems. These symptoms can change a lot depending on how much damage there is and what's causing it. To figure out if someone has necrosis, doctors look at the person's medical history, do a physical checkup, run blood tests, and use imaging tests like ultrasound, CT scans, or MRIs. Sometimes they might also take a small piece of the liver, a biopsy, to look at more closely. This can clearly show the damage to the liver. In short, necrosis is a serious problem that needs medical help. The liver turning darker and blacker because of this condition shows that cells are dying and there's inflammation. This can only be seen with special medical tests, not just by looking. To treat it effectively, it's important to quickly figure out and deal with the root cause. The second condition that can lead to liver discoloration or the appearance of darker blackish spots is hemochromatosis. Hemochromatosis is a health condition passed down through families that makes your body take in too much iron from the food you eat. This extra iron gets stored in different parts of your body, mainly in the liver, but also in the heart, pancreas, joints, and skin. Having too much iron in these organs can make them work badly over time and may lead to serious health issues like liver disease, heart problems, diabetes, and arthritis. In the liver, too much iron can make it turn darker and might cause scarring or cirrhosis if it's not treated. Hemochromatosis usually happens because of a change in the HFE gene, mainly with the C282Y and H63D changes. These changes mess up how the body controls iron absorption, causing too much iron to build up. This condition is passed down in a way that means you need 2 copies of the changed gene to really be at risk for having too much iron. But if you have just 1 copy of the changed gene, you might also take in more iron than usual, though you probably won't show any symptoms. Some infections and liver problems can change how the liver shows up on an ultrasound, CT scans, or MRI. These changes might show that there's damage or disease affecting how the liver works and its overall health. The liver's response to infection or disease can vary widely, from inflammation and swelling to the development of fibrotic tissue or the accumulation of fat. If you find this information helpful, we encourage you to show your support by liking this content, subscribing to our channel, and enabling notifications for the latest health and nutrition tips. Infections leading to liver color changes. Viral hepatitis A, B, C, D, and E are viruses that attack the liver, leading to swelling and damage to liver cells. On medical scans, this might look like the liver is bigger than normal or its texture has changed. Long-term hepatitis B and C can cause worse damage, like fibrosis, scarring, and cirrhosis, hardening of liver tissue, which you can see as uneven or hardened areas in liver scans. Parasitic infections. Diseases like schistosomiasis from parasitic worms and echinococcosis from tapeworms can cause cysts or granulomas, inflamed areas, to form in the liver. These show up on scans as abnormal lesions or masses. Bacterial infections. Bacteria causing diseases such as leptospirosis or syphilis can make the liver bigger, a condition called hepatomegaly, and change how dense it looks on scans. Liver abscesses, which are pockets of pus caused by bacterial infections, also appear as fluid-filled spots on the liver in imaging tests. Non-infectious conditions affecting liver appearance. Fatty liver disease. This happens when fat builds up in the liver cells. On ultrasound images, the liver looks brighter, and CT scans show it has different densities. It's often linked to being overweight, having type 2 diabetes, or drinking too much alcohol. Cirrhosis. This is what you get after long-term liver disease, where healthy liver tissue turns into scar tissue, making the liver look bumpy and hard on scans. It can come from ongoing hepatitis, drinking too much alcohol, fatty liver disease not related to alcohol, NASH, and other long-lasting liver conditions. Liver cancer. Liver cancer can show up on scans as lumps or spots that might look different in size, shape, and how they appear compared to normal liver areas. This helps doctors tell apart cancer from non-cancerous spots. Liver cancer can start in the liver or spread from other places in the body. Liver problems can show up in different ways because the liver is so important for breaking down food, cleaning your blood, and getting rid of toxins. Even though you can't see your liver or how it's doing, knowing the signs of trouble can help you spot liver issues early on. The following are signs you should pay close attention to. Jaundice or yellowing of the skin and eyes happens when bilirubin, a yellow substance from breaking down old red blood cells, builds up because the liver can't process and get rid of it properly. Jaundice is a clear sign of liver problems, showing that the liver isn't working right, or there's a blockage in the pathways that bile travels through. Abdominal pain and swelling, known as ascites, is when fluid builds up in the belly, often because liver scarring or cirrhosis slows down blood flow in the liver, causing pressure and fluid to leak into the belly area. If your belly is swollen and painful, it might mean you have cirrhosis. Swelling in the legs and ankles. Swelling in the legs and ankles, also called peripheral edema, happens when there's too much pressure in the blood vessels, causing fluid to build up. This is often linked to cirrhosis or heart problems. Swollen legs and ankles can show that liver problems are messing with how blood flows and how the body handles fluids. Itchy skin. When the liver isn't working well, bile salts can build up in the blood, making you feel itchy all over. If you're itchy but don't see a rash, it might be a sign of liver problems, even though it's not as clear-cut as other symptoms. Dark urine color. When too much bilirubin gets passed out through your kidneys, it can make your pee darker. If your urine is dark, it could be an early warning that your liver isn't working right, especially if you also have jaundice. Pale stool color. If there's not enough bile pigment getting to your stool, usually because a bile duct is blocked, your number 2 won't have its normal brown color. If your stool is pale or looks like clay, it might mean there's an issue with how bile is flowing, pointing to possible liver or bile duct problems. Nausea or vomiting. When the liver isn't working right and can't filter out toxins well, these toxins can build up in your blood. This can mess with your stomach and make you feel nauseous or cause you to throw up. Feeling sick to your stomach or vomiting can be signs of sudden liver damage or worsening of ongoing liver problems. Catching these symptoms early is key to dealing with liver disease before it gets worse. Liver problems can vary from minor issues, like temporary increases in liver enzymes because of medications or drinking alcohol, to major health concerns such as hepatitis, fatty liver disease, cirrhosis, and liver cancer. If you notice any of these symptoms, especially more than one at a time, it's important to see a doctor. They might ask for blood tests, scans, or even a liver biopsy to figure out what's wrong and how to treat it. If you're worried about your liver, it's a good idea to see a doctor. They can do different tests to see how your liver is doing, like blood tests which can show if your liver enzymes are high, which might mean your liver is inflamed or damaged. Or they can use imaging tests with tools like ultrasound, CT scans, or MRIs, which can help get a closer look at your liver. Another test they can do is called a liver biopsy, where they take a small piece of your liver to check how much damage there is. Keeping your liver healthy is super important because it's like your body's own personal detox machine. It cleans your blood, helps digest food, and fights off infections. If you want to give your liver a little extra love and help it detox, there are some simple home remedies you can try. Remember, these are not cures for liver diseases, but ways to support liver health. Enjoy some green tea. Green tea is packed with antioxidants that support liver function. Drinking green tea can help improve your liver health by reducing fat storage in the liver and improving liver enzyme levels. You can also try turmeric tea. Turmeric is a spice known for its anti-inflammatory properties. Making a tea out of turmeric can help boost liver detoxification by supporting enzymes that actively flush out dietary carcinogens. A simple way to make turmeric tea is by boiling water with a teaspoon of turmeric and letting it simmer for a few minutes. Thank you for watching Liver is Turning Black. How can you tell? On Healthy Vibrance. Don't forget to like, subscribe, and turn on notifications for more health-related content. See you in the next video.